If you are in your first trimester, or sadly outside of your first trimester, and you are suffering from morning sickness like I have every pregnancy for about 10 weeks of just sadness and regretting my life choices, this video is going to be for you because I'm going to break down what I found to actually be really helpful for me in relieving morning sickness so that I can be a functioning human being during my first trimester. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula, and I have been pregnant 6 times. I have 4 babies, though. I did have 2 miscarriages, and I had morning sickness every single time. And I was like, for sure, this is the time I'm not going to, and I had it. I had it every time. And so I am well-versed in all of the remedies.
And I'm Roxanne. I'm a labor and delivery nurse and student midwife, and I've had 3 pregnancies, but I only had morning sickness for 2 of them.
Good for you. So I have had every single time. So solidarity if you are suffering and you are trying to find the things that bring relief. During my first pregnancy, I had no idea that there was anything that you could do, and I just suffered for however many weeks. I just didn't eat anything. I lost like 10 pounds. It was a really miserable time frame. During my second pregnancy, I realized that there was things that we can do to try to decrease this. And I found lemon water. Just a bottle of water with an entire lemon squeezed into it was really helpful because I had this very metallic-y taste in my mouth all of the time. And that was like my morning sickness, was this metallic taste. And I found that the acidity from the lemons helped to kind of quell that. And that was like really helpful for me during that pregnancy. Was lemon water was what helped me with morning sickness during that one. Other things that I found to be really helpful with morning sickness was seasick bands. So the ones that go on your wrist. I surprisingly found those to be really helpful.
C-bands, I think.
So I wore them for like 10 weeks. And I was afraid to take them off because I was like, if I take it off, I'm not going to feel good. And when I take them off, I didn't feel good. So I found like the seasickness bands, like the C-bands, to be like really, really helpful.
So those work because of acupressure points. There's an acupressure point where like the C-band is putting pressure that is supposed to help with nausea. And so you just like wear them. Multiple people have come into the birth center wearing them during their first trimester, and they say they also...
It really helped me. I was surprised. I tried it during this last pregnancy, and I was like shocked with how helpful it was for me. And then the other thing that I found really helpful was eating.
Oh, what?
Which seems counterintuitive because I'm like, well, I feel sick when I eat. So eating protein and was like super helpful for me. And so like collagen, like taking something with collagen in it, like a smoothie with collagen in it, like eating something that had protein. So like something a little bit more hearty, like oatmeals and stuff with like protein in it seemed to be really helpful because I found that I would get really nauseous if I was hungry. Like, we had an instance where I was vomiting outside a grocery store. Like, I was so hungry, and I was like, we need to go eat now, guys. Like, I'm not feeling good. And we're outside a grocery store, and I'm vomiting in a bush because we waited too long. And Roxanne is like, do you want me to get you something? I'm like, I literally cannot talk right now. I'm vomiting. I'm literally heaving. Like, stop trying to ask me questions. So anytime I was, like, super hungry, I would get really nauseous. And so I had to eat frequent meals or snacks throughout the day, preferably high in protein to help with that. So you just need to find your safe food. And that's what I recommend.
Small, frequent meals to avoid your stomach from being empty. That was the only time I experienced nausea with my first, was when I didn't eat breakfast before heading to work because I had about a 35-40-minute drive. And once I got to work, if I hadn't eaten, I was like, oh, I'm a little hungry. And I would eat a thing of cheese, and then I was better.
The last thing that I found to be like really helpful for me and was like the game changer in managing nausea was the little combo of Unisom and B6. So I would take it at night. So I would take my like Unisom, which is like a sleep aid, and then I would take the B6 vitamin. And the next day I would feel so much better. Like it was a super helpful thing for me. I know not everybody wants to take any sort of like medication during their pregnancies. But for me, like that was like the one thing that was like definitely like most helpful. And I had tried all of the other things. Like I tried the seasick bands, which was like helpful. I tried making sure that I was eating, but that little combo was kind of like the final thing that I needed to really find relief during that first trimester. And it was something that I asked my midwife about, where I was like, how much can I take? And so if you are interested in something to help you with morning sickness, expressing to your provider, "I am miserable, please help me," that can be a really great way to go to know how much of it that they recommend that you take.
Yeah, and your provider, that's what they're there for. There are really common symptoms during pregnancy that occur that we have treatments options for. And morning sickness or all day sickness is one of the things that, like, we have lots of options. We usually obviously would recommend trying the non-invasive ones first, so doing the C-section band. Some people will do acupressure or chiropractic care or any of, like, the things that aren't medication first to see if any of those help. And if it doesn't, then we have the Unisom B6 option, as well as there is, like, prescription medication. So it's called Diclegis, and it's pretty much just Unisom and B6 in a prescription form. So Unisom B6, it's over the counter. You can grab that from, like, pretty much any convenience store or prescription like Walgreens or CVS, whereas Diclegis it is a prescription that is, like, given to you by your provider, but both of them are pretty much the exact same thing. Diclegis was studied, like, pretty intently and intensively because some people thought that there were some side effects to it or long-term complications, so it's one of the most studied drugs that is given during pregnancies, and it has been proven to be safe, but some people still don't want to prescribe it during pregnancy, and so they just took the ingredients of Diclegis, which is Unisom and B6, and prescribed that as, like, an off-label use.
The last thing that I found really helpful for me with morning sickness was magnesium. So hydration and water and salts and stuff seem to be really helpful. So I was a really big fan of LMNT. I mean, I'm still a big fan of them. Was a fan. I am currently a fan of LMNT. And so drinking like electrolyte salts and waters and stuff can be like really helpful because of the magnesium in it, which can help you with morning sickness as well. So my personal favorite element is on the salty side. It has a very strong flavor. I am about strong, bold flavors in my life. So if you want to check out LMNT, you can get a free sample pack with any purchase. We recommend the Insider Bundle because you get 4 boxes for the price of 3. And then
They have a pretty good return policy if you absolutely hate
so if you get it and you're like, I hate Mama Stay Fit for the recommendation, this is the worst stuff ever, they will give you like a refund without any questions asked. So I do really like their customer service as well. So if you are suffering from morning sickness, there is relief out there. You don't have to just survive like I did my first pregnancy. There is some things that we can do to kind of decrease the intensity of it. I found one eating food, especially high in protein food, to be really helpful. You got to find your safe food though, because not every food is going to work for you. The seasickness bands, so the C bands with that acupressure point, for whatever reason, I mean, I know why, but it was a game changer. I was surprised how much of a game changer it was for me. Drinking lemon water, the acidity was just really nice, which is probably why the element water was really helpful too, because it is on the more acidic side as well. So magnesium can be really helpful. The Unisom B6 combo, game changer. It was wonderful. It was like the one thing that definitely really took me over the edge to being a functional human being again. So there is relief. You might have to play around with a few different things to figure out what works best for you. But I hope that this was helpful for you so that you can be a functioning person again in your first trimester. If you want more support throughout your pregnancy, check out our online prenatal fitness programs and our online childbirth education course. Our online prenatal fitness programs are designed to be done throughout your pregnancy, so from the beginning all the way to the end, but you can start at any time. So if you're in your first trimester and you're like, I am miserable and exercising makes things worse, we will see you in the second trimester when you have some relief. Our prenatal fitness programs are offered in 2 main formats. We have our app-based format, which is going to be a list of exercise with short demo videos. And then we have our on-demand based format, which is full-length follow-along videos that you work out with at the same time. You can check out both of our program options on our website at mamastayfit.com. And both programs come with birth prep workouts and pelvic floor release workouts as well. So you can check them out on our website and use code YouTube10 to get 10% off any of our online offerings. In addition, you can bundle prenatal fitness with childbirth education, where we talk all about your options, the science of birth, how to create space within your pelvis, how to prepare for birth, and all that good stuff. And you can bundle them together to save an additional 15% off. So with code YouTube10, all our bundles are 25% off, so pretty much free. So check them out on our website at mamastayfit.com.